Well, before we get started, I'm going to go ahead and give the medical disclaimer. So the information provided is for educational purposes and is not intended as medical advice or a substitute for medical advice of a physician or other qualified healthcare professional. And you should not use this information for diagnosing a health or fitness problem or disease. And you should always consult with a doctor or health care professional for medical advice or information about diagnosis and treatment. And the information in this presentation has not been evaluated by the FDA or any other medical body. So good morning, good afternoon, good evening, wherever you are in the world. This is Dr. Doreen Arbo, and I'm your host on today's call. And so for those of you who don't know me, I'm a clinical researcher and an author of several books. So welcome to our product Q&A call with Mr. Clayton Thomas, who is the chairman and founder of Root. And Clayton has over 25 years of experience in the health and wellness industry. And for the last 16 years, he's focused on detoxification and nutraceutical formulations with a simple philosophy, cure the cause. Hello, Clayton, and welcome to the call.
Happy Tuesday. I think for the next intro, I want you to do something different. You do your intro that you're a researcher, you're a PhD, you're an author, and just say Clayton is not. And then we're good.
No, I'm not going to say that. Don't be silly. Well, so today what I want to do is I want to continue our vitamin D discussion. And the topic today's topic is about autism. Oh. And how clean slate and zero in may help. And, I haven't said this in a long time, but clean slate and zero in is one of the most important foundational products. Something that I think everyone will recognize after this talk. And today we also have a special guest on our call, and this presentation will most likely go over the hour, but we will continue. But first I'm going to go ahead and recap from our call from last week. So last week we talked about the importance of vitamin D. We discussed vitamin D for healthy bones and weight loss. Oopsie, went too fast there. And I can't go back. Well, and we also learned that vitamin D also has 27 receptor binding sites. And we also talked about erectile dysfunction related to vitamin D. And we learned about the importance of vitamin D for the ladies' garden, for those that are perimenopausal, going through menopause, or postmenopausal. And just so you ladies know that perimenopausal normally starts in your 40s, but some women, it can actually start earlier, like in your 30s. We also discussed fertility, vitamin D and fertility, pregnancy, and touched on the relationship between vitamin D and autism. We talked about the combination of vitamin D and vitamin C along with zinc. It helps to promote tight junctions in the gut, which we're going to revisit on this call again.
With one of the best people possible to discuss the subject.
So what this slide here was about what we learned last week about vitamin D, and that it actually needs to be, in order for it to be utilized properly, it has to go through 2 hydroxylations. The first one in the liver, and the second is in the kidneys, and that is where the active form of vitamin D is. So, and what we learned last week was that heavy metals actually interferes with normal vitamin D metabolism by blocking the renal synthesis of the active form of vitamin D. So that's really important. So our special guest is Dr. Stefan Rao.
Once again.
Let's go.
Why?
So, I told Stefan that I'm not going to read his bio because it's like 10 minutes long, but I'll just give the highlights. No, it's good. It's good. So, because there could be some new people on here, and I just want to give you the credit that you deserve. So Dr. Rao is a human biologist. He is a virologist and an expert in the gut microbiome, and he's also an author. And if that's not enough, he also has special education in autism and ADHD In addition to that, he's also an expert in vitamin A and vitamin D. He also graduated with University Diploma in Human Biology at the Institute of Physiology, the Department of Medicine at Phillips University in Marburg, and he studied at the Institute of Medical Microbiology and Virology Department of Molecular Oncology, and the Institute of Biochemistry at the University of Gießen, where he received his PhD. He worked on oncogene, retroviruses, HIV, and viral research. So Dr. Rao is here to talk to us today about vitamin D and autism and much, much more. And welcome to the call again, and thank you for joining us.
You want to talk about all this stuff. I'm only here.
Yes, but you're going to help me.
I'm only here because the reason is why I have a diploma of dyslexia. You see that? Yeah. I have special educations about autism in Germany a couple of years ago, and I'm working with kids having suffering from ADHD, autism, and dyslexia. It's about 5 years, 7 years ago. Yeah.
Great.
Please.
Well, thank you.
There.
What's that?
He has some credentials and experience that I think will be valuable for the community. I think this will be fun.
He's very bashful. Ooh, making him big now.
It's your call, Dory.
So today we're going to talk about autism. As you can see here from this slide, autism has increased 178%. It's incredible, right? This is by the CDC. They're saying, depending on what source that you want to quote, 1 in 59, some say 1 in 52 or 1 in 54, but nonetheless, it all ties in. It's into what we're going to be talking about today in terms of why this escalation. So then I want to look at the countries. So for example, children in Japan, aged 5, it's 1 in 30. It's even worse than the US. And also in China and Hong Kong, researchers have found that there's like skin-related disorders and autism. And they believe that this increase is from long-term exposure of children to mercury, lead, and arsenic in the diet and because of their environment. In India, 1 in 100 children under the age of 10 has autism. In Hong Kong, the rate is actually 1 in 27. And like I said before, in the US, it's 1 in 54, depending on who you're citing from. And interestingly enough, New Jersey actually has the highest rate of autism in the US. In Norway, children from 0 to 10, it's 1 in 166. And the highest rate is in Rogaland. That's the area that I live in. But don't worry, I'm not having any babies, so I'm good. And in the UK, it's about 1 in 100 are diagnosed with autism. So this is a slide regarding what we're going to be talking about. We're going to be hitting on all of these points here, and then later on we'll tie it all together when we get done. So we have a lot of things to cover.
Let's go. So
what is autism? Well, according to the Autism Society, autism is a complex, lifelong developmental disability that typically appears during early childhood and can impact a person's social skills, communication, relationship, and self-regulation. Autism is defined by a certain set of behaviors and is a spectrum condition that affects people differently and to varying degrees. DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders. This is the 5th edition that has redefined autism and actually classified it as autism spectrum disorder and also included Asperger's, PDD-NOS, which is pervasive developmental disorder, not otherwise specified, which these disorders are now grouped into one, which they call autism spectrum disorder. So, and that also includes a myriad of other known disorders, for example, ADHD, OCD, and ADD. That's also in this group here. So let's look at causes and risk factors. We do not know all the causes of autism spectrum disorder. However, we have learned that there are likely, many causes of multiple types of ASD, and that there's many factors that are more likely to have children to have ASD, including environmental, biological, and genetic disorders. And as you can see here, most scientists agree that genes are one of the risk factors that make someone more likely to develop ASD. If you have a child that or has a sibling with ASD, then the risk is higher. Also, there are certain genetic and chromosomal anomalies, such as Fragile X syndrome. But, and then of course, there's certain medications taken during pregnancy that's also linked to a higher risk. But what I really want to focus on is this critical period for developing ASD that's occurring before, during, and immediately after birth. I think that that's where our focus needs to be. So that's what we're going to talk about today. So what is the role of vitamin D in autism? Wow, this is really interesting. And as you start diving into all the research, you start to, even today I found something new, and I just had to add it to the slides. And every day you find something. Look at Stefan, he's laughing because he knows. It was just like, it's so complex. It's incredible. Okay, so the role of vitamin D in autism. So there's a growing body of literature that actually suggests that gestational and early childhood vitamin D deficiency may cause some cases of autism. And children who become autistic have lower vitamin D levels at 3 months of gestation, at birth, and at age 8, compared to those unaffected by unaffected siblings. So vitamin D regulates about 3% of the 26,000 genes in the coding human genome. As a neurosteroid active in the brain, it affects cellular proliferation, differentiation, calcium signaling, neuroprotective actions, in addition to neurotransmission and synaptic plasticity. And one of the things is that, for DNA stability, researchers actually identified that there's at least 5 vitamin D dependent genes that code for DNA repair proteins, whose only job is to fix the mutated DNA and also prevent DNA double-stranded breaks. And as far as anti-inflammatory actions, well, autism is also a disease of inflammation, and vitamin D has anti-inflammatory actions. And studies show direct and indirect anti-inflammatory effects involving both innate and adaptive immune system. So a question is, as an autoimmune disease, well, autism is among more than 160 human autoimmune diseases, with several autoantibodies in the brain identified both in fetuses and autistic children. And these autoantibodies may be caused by genetic predispositions combined with environmental triggers, such as viral illnesses or prolonged exposure to certain chemicals or toxins. And the levels of antibodies are directly associated with the severity of the autism. But most importantly, one study recently concluded that most autoimmune disorders studied so far are somehow involved with vitamin D deficiency. Did you know that, Clayton?
That's a new part.
I thought that was really interesting. So this is really interesting too, decreasing seizures. Well, up to 25% of children with autism, they have seizures, right? So correcting the vitamin D deficiency could also, or may also, help control seizures. In a recent open study, 8 of 13 seizure patients were extremely deficient, vitamin D deficient, and investigators then corrected the vitamin D deficiencies in all 13 subjects by administering a one-time dose of 40,000 to 200,000 international units of vitamin D3, followed by 2,000 to 2,600 international units daily, a daily dose of vitamin D3 for 3 months, depending on the weight. And this intervention reduced seizures by 40%. So that's pretty impressive. And then also there was 2 open trials that found high doses of vitamin D improves the core symptoms of autism in about 75% of autistic children. A few of those improvements were, I mean, they're really pretty remarkable. And the vitamin D doses that they used in these children were 300 international units per kilogram per day, and up to a maximum of 5,000 international units per day. So in terms of prevention, a recent study showed that vitamin D supplementation during pregnancy was 5,000 international units per day. And during infancy and early childhood, it was 1,000 international units per day, and significantly reduced the expected incidence of autism in mothers who already had one autistic child from 20% to 5%. So I think that's pretty significant. Of course, we're not saying that you run out and go get a bunch of vitamin D and start supplementing yourself like this. It's just to show you what the literature, what the research is saying.
Well, and that's in a controlled environment. And
yeah, exactly.
That's going to lead into a couple questions for Dr. Rao in a minute, but he'll probably giggling right now.
He'll have plenty to say.
Oh, no.
No, yeah. Oh, yes, you will. Don't give me that. He's been trying to get out of it all week. So the autism, so this is interesting too. Autism spectrum disorder is more common in boys. And so the biological cause of autism is unknown, but okay, as we've shown that many risk factors, low vitamin D in mothers causes an increase in testosterone in the brain of male fetuses, as well as maternal blood and amniotic fluid. In addition to its role in calcium absorption, vitamin D is crucial to many developmental processes. Our research also showed that in vitamin D deficient male fetuses, an enzyme which breaks down testosterone was silenced and could be contributing to the presence of high testosterone levels. So what I thought was interesting about this was showing that how this low vitamin D in mothers was causing this increase in testosterone and actually silencing the breakdown of the testosterone. I thought that was pretty interesting. So here we're just trying to show connections. Okay, so again, we had the slide last week. This is about vitamin D deficiency during pregnancy, and of course, increased autism cases when conceived in the winter months due to lower vitamin D levels. Okay, so this is just to show you vitamin D and autism studies. There's plenty of them. Like I have there's probably probably 100 of them.
Yeah, there was 3 pages in the compendium that you did.
But I found more now. There's even more.
It's like a great infomercial. But
yeah.
Wait, there's more.
There's more, and there's more. And I had to stop after 3. And then there's more, because I didn't even know this, but because Dr. Rouse is also an expert in vitamin A, I thought, I'm going to look up vitamin A and autism and see, if there's a correlation here. And look, there is. Stefan, did you want to say anything about vitamin A and autism?
For me, vitamin A is one of the forgotten vitamins when you're looking at the immune system, and it's worked together with the vitamin D. And you need vitamin A in autism too, because it's depends on the inflammation also. Yeah. Mm-hmm. And everything happens in the gut.
Yes, like this study here that I highlighted here, the effect of vitamin A supplementation on gut microbiota in children here. That's the point there. That was the pilot study. Okay, so this one was interesting too.
Yeah.
Too much vitamin B12. So here in this one here, a few years ago, an American study showed that pregnant women with high levels of B12 were more likely to have children with autism. And researchers in Norway were intrigued by this finding and conducted a study where they examined the blood of Norwegian patients with autism spectrum disorder. And the study showed that significantly more people with this diagnosis have a high level of B12 compared to healthy ones. In fact, they noticed that high levels of B12 without supplementation. And other research has shown that women with too little B12 during pregnancy can damage a child's brain development. So the medical theory has held that B12 levels cannot become excessive because the body regulates itself by excreting any excess of vitamins through pee and stools, right? Urine and stool. So I thought this was a really interesting study as well, but there's just not enough data on this. So here's another vitamin as well.
But this is the relationship to the homocysteine. Yeah?
Oh, I knew you were going to say that.
Folic acid.
Yes, exactly.
There's a gene that there is a problem with one enzyme you have in the body, for example, the MTHFR.
Well, and you just hit on what I was going to ask you about.
Homocysteine and autism is related. Yeah.
Well, an impaired methylation, whether it's due to the MTFR gene or damage to the MTHFR gene in the womb from certain deleterious metals.
Okay. So, Dr. Rao, take it away. It's your slide. It's your slide. It's been beautified.
Oh, it's my slide.
It's your slide. It's been beautified.
First time I see it. Okay. Do you know who has autism? Which people have autism? Which prominent people have autism? There are a couple of people who has Asperger's syndrome, like Bill Gates too, and Woody Allen and Einstein. But I want to say, because we are talking now about the microbiome, there is still much to be discovered in terms of understanding the bidirectional communication network between the central nerve system and the microbiome ecosystem. And there is an increase of scientific research in the last year. 80% of the scientific research are looking for the interaction between the microbiome and the autism. And the highlights are that the children with ASD frequently have gastrointestinal symptoms like problems with their gut and constipation. The second is the intestinal microbiome may be different in ASD patients compared to controls. Yeah, this is the second. And the third is in ASD, the connection maybe exists between the gut microbiome, the symptoms in your gut, and the behavior these people have. Depends on the behavior. And the fourth is that the gut-brain axis may affect brain development and the behaviors. And what we can see here in this slide is, this slide illustrated the possible mechanism involved in the microbiome brain interactions in the context of the ASD. You can see on the right side, the maternal contribution is significant in determining the early intestinal colonization. What we can see here is the vaginal dysbiosis. And this is one of the most important things.
Can I just stop you for a minute? Because I think it's really, it's really important to understand this slide here, because like when we talk about the vaginal microbiome, I mean, women today are just lining up and getting C-sections, like scheduled C-sections to have their babies, and they need to go through, the babies need to be delivered to be able to get them, you know, what they need for them to create their own microbiome. Okay, continue. That's all I wanted to say.
This is important. The vaginal dysbiosis is one of the vaginal microbiome is important in developing the ASD. Yeah. It also has reported then that infants born extremely preterm have tenfold higher risk of developing ASD compared to infants born at term. Yeah. On the other hand,
those two,
please.
How do you perceive the correlation between preterm birth and, you can say, on-time birth and the risk for autism and such? Is it due to a lack of nutrients and such, and then the disconnect with proper delivery in the microbiome?
It depends on the microbiome of the mother, and also on the stress of the mother in this time. What they found is that that's not only perinatal, that's not only postnatal, that's also perinatal, and before in the in the preterm. Yeah.
I have a little slide on that later.
The second is the oral microbiome. We also have here on the right and the left side. There is an interconnection, and the oropharynx serves as an important bridge of the GI tract and is thought to play a significant role in the pathology of the ASD. It's also very interesting. The second microbiome here. And we have also the epigenetic programming in the brain, like the small chain fatty acids and the BDNF, which you can see above the environment, and the epigenetic programming of the brain is also involved in the pathology of the ASD. Yeah.
Anything else?
No.
No? Okay.
Oh,
Voila.
This is also interesting. The gut dysbiosis, you can see here 7 steps, I think so, 7 steps. It's a little bit small for me.
7 steps.
Yeah, Mom, please. I have to zoom a little bit.
I sent this to you.
It's a little bit small for me now here.
Okay.
Okay, I can see it. What we can see here, there's increased permeability of the intestinal tract here. And what we can see above is the gut, and there is some bugs. First of all, is the Akkermansia muciniphilia. It's a very interesting bug because there is a correlation.
Oh, right here.
Yeah, this one, this one. This is a really new bug found about 15 years ago from a Belgian scientist called Ackermann. And this is responsible, this bug, for the integrity of the intestinal epithelial cells you have here, which you can see. The first of all, you have an alteration in the bug microbiome. This is the first step. The second step, when you have a disbalance in this microbiome, this degrades the mucin and reduces the
Mucus.
The mucus, yeah. Responsible is here the Akkermansia, one of the most important bugs in the gut for other diseases too. And then in the third step, we have a leak. And I told you before, if you have a leaky gut, you also have a leaky brain when you're looking above. And there are a couple of proteins involved here in this tight junction called claudins. You can see it here in the bloodstream, the claudins. These are the same proteins which we have in the blood-brain barrier too. And then we have, when we have a problem with our intestinal epithelial cells, we have a problem with pro-inflammation, and this you can see at step 4 here. The pro-inflammatory cytokines produce the interleukin 6A. There is also another one, it's the TFN. They're produced and they're in the bloodstream in your body, and you have an inflammation. Yeah, there are also the small chains fatty acids important here, and this will also be via the nervus vagus. You can see it here above in the yellow line, interacts with your brain. This is one of the nervous ways you have here. And in the 5th steps, we have a neuroinflammatory state, which decreases the microglia cells. And then in the 6 steps, we have these small change fatty acid alters the neurotransmitter synthesizers, like dopamine or serotonin, yeah? And then this will lead to an autistic related trait. Yeah, this is the chain between the gut, the immune system, and the brain, what we can see here. And this is one of the most important things, because a lot of scientists think that autism is a microbiome disorder, or a microbiome brain gut disorder. I show the next slide.
Okay.
Sorry.
Yes.
This is another scientific paper from last year about COVID. And here you can see what Dory told before, that the vitamin D, C, and zinc helps to promote the tight junctions. Yeah, and what you have to know is that zinc is essential for the integrity and homeostasis of the intestinal barrier, and also not only in the intestinal barrier, also the blood-brain barrier. This is important.
Everybody's going to go out and get a run on. We're going to go get vitamin C, D, and zinc.
Yeah.
Yeah. All right.
It shows that the tight junctions are function well when you have enough vitamin D, C, and zinc. And the vitamin zinc, the zinc is I think one of the most important trace elements when you get older. It's only also important for several diseases like prostate cancer. And
well, this is also important for children with autism as well. I saw this in several studies as well, talking about this combination.
But then also why they're not absorbing when a lot of it is in your diet, but what's in place that's creating the disconnect or blocking a lot of those binding sites from not allowing it to be used properly.
We're going to get to that.
Oh.
Mm-hmm. So this is very interesting. Because since Dr. Rao was talking about the gut, it only is natural that we move to serotonin. So serotonin is essential in brain development. And what's interesting, according to research, is that serotonin and vitamin D actually go hand in hand. It's actually a key factor. The amount of vitamin D level in a mother's blood is crucial, and it's needed for fetal brain development. And vitamin D activates the gene that makes serotonin in the brain. And this is why in autism, the mechanism of action for serotonin uptake is impaired. So interestingly enough, researchers, Dr. Patrick and Dr. Ames, they actually demonstrated that vitamin D hormone is needed to activate the gene that creates an enzyme, the enzyme tryptophan hydroxylase 2, which then converts to essential amino acid tryptophan to serotonin in the brain. And this finding suggests that adequate levels of vitamin D may be required to produce serotonin in the brain. And additionally, they also found evidence that the gene that makes the enzyme tryptophan hydrolase 1 is inhibited by vitamin D hormone, which halts the serotonin production in the gut and other tissues. When found in excess, it promotes inflammation. So the key point here is that prenatal vitamin D levels are crucial. And vitamin D activates the genes that make serotonin in the brain while turning down the one in the gut, which is actually creating this high peripheral blood serotonin that, we talked about that the other day, Stefan.
Yeah.
Yeah.
We talked also about one link of the serotonin in the interaction of bisphenol A and the ASD.
Yes, so I think that's going to be on this next slide here.
Okay.
There. Oh, that's this one here. So this is this. Yeah. This is just this one here about showing the blood elevation.
Yeah, because serotonin don't transfer to your blood-brain barrier. Yeah,
Right. From the gut, it
that's
can't
the
get to
point.
the brain.
It
But
can't
in
get in the
children
brain.
with autism, there's too much serotonin in the blood and not enough in the brain.
Yeah, because
But
95% is produced in your gut. Yeah.
and that's why they were talking about the vitamin D, how crucial the vitamin D is, because that can turn it on, and at the same time it can turn the one off for producing too much in the gut, and then producing in the brain as well. Does that make sense?
Yeah.
Okay.
We have to get it in the brain. Oh,
We
autism pineal.
And so now we move to this one here.
Yeah.
Oh, so can I throw one question that just came up in the chat?
Sure.
The question was, what if your mother doesn't have enough vitamin D prenatally? Can, after the child is born or after the fact, is there anything you can do to help that?
I've read some studies that talk about that they actually have given extra vitamin D to help with the symptoms, but it's not something that's going to take it away.
So there we go. The short answer. And now,
Stefan, did you want to say something about that?
About the vitamin D
Uh-huh.
in pregnancy, you can't it's a preventive treatment to use vitamin D in ASD. You can, this is not the solution. Yeah.
Uh-huh.
Perhaps these symptoms will be better, but you can't there is no solution of the autism. Yeah.
Right. That's what I'm saying.
Because it's really complex what happens here with the autism. Yeah. It would be very easy to use vitamin D and you get rid of your ASD.
Yeah, no.
And this is not
But
possible.
what it can do, possibly, it may help with the symptoms.
It can help, yeah.
Yeah, it can help with the symptoms. And that's what I talked about earlier, was how they gave it to children, young children, those massive doses of vitamin D, and actually help like with seizures and things like that. So it can help with some of the symptoms of ASD, but it's not going to, you have ASD, it's not going to take it away, right? So let's talk about autism and in the pineal gland pineal dysfunction and melatonin. So melatonin is a natural hormone that is produced by the pineal gland in the brain. And darkness promotes the pineal gland to start producing melatonin, while light causes the production to stop. And as a result, melatonin helps regulate the circadian rhythm. However, in children with autism, nearly 80% of autistic preschoolers have disturbed sleep, which has to do with pineal dysfunction and melatonin.
Oh, this is
this is your slide. This is the main.
There's everything written on this slide. You know that serotonin, melatonin, and you have the pineal gland. Yeah. And what you can see here, first of all, above pineal gland malfunction, this is the whole regulation. What happens with a neurotransmitter of serotonin, melatonin, and the DMT. There are a couple of, this is a very interesting research here. You can treat ASD also with melatonin, because the most subjects who have ASD suffering with sleep disorders. And here is they found that there is on the left side, you found the bufotenine. This is a DMT analog you found in ASD subjects. And this is the interaction between the pineal gland and the abnormal neuroplasticity, and this will lead to an autism spectrum disorder. And it's described what happens here, the gene mutations and the irregular expressions related to the melatonin synthesis. You know that there is also vitamin D is involved in this synthesized pathway in ASD. What we have next, the decreased activity of the MAO of the amino oxidase, yeah, results in the hyperactivity of the DMT, And there's one interesting thing you have to Google is the mTOR. This is there are some studies about this hyperactivation of this gene or protein. Nevertheless, you have problems when you have a pineal malfunction, and these research papers found there is one in a couple of subjects who have ASD. And this is a very complicated pathway here in the brain, depends on the serotonin, on the receptor 5-HTA2, and the BDNF, this brain development nutric factor, is also involved in this pathway. But there is a lot of research about this issue here. But what you can see, there is studies about the pineal gland dysfunction and the melatonin and the ASD. This is very interesting when you think about dopamine. We also have a dopamine hypothesis about the ASD also. I think you want to talk about this later, about the dopamine too, Dory?
Oh, absolutely.
Yeah. Mm-hmm.
Stefan, can I throw you a question on the DMT aspect, because it's become such a conversational point with the microdosing conversation of LSD and mushrooms and such. So what you're showing in this is because of improper pineal gland function and the conversion of tryptophan, that in autism spectrum, there's a little extra DMT that's being produced that's causing the hallucinations, or you can say
yes,
improper brain function that leads to the spectrum, because you could theoretically state that because pineal gland function is not working right, these kids are tripping constantly.
Yes, this is a point. You can see a behavior of these kids, or of these people suffering ASD. Yeah.
So here's another question, and I'll throw this at you here once we get into more of it. So if you're able to enhance pineal gland function in someone else by using specific ingredients that can produce more dopamine and serotonin to get to the pineal gland, you actually could allow the pineal gland to produce DMT.
That's the way. The same is with HDAD.
Okay.
With these drugs using there, also influencing the dopamine, like the one you called Ritalin.
Yeah.
It's also influencing the dopamine. It's a dopamine reuptake.
Reuptake inhibitor.
Yeah.
Yep.
And you want to increase the dopamine, and here,
just like cocaine.
It's like cocaine. But also here you can see it's a balance. It's a homeostasis.
Yeah, it's like you said, it's the mobile, right?
It's a mobile. It's a mobile.
Being able to have that intricate balance of not being off in one area even a little bit as everything else adjusts.
Yeah, when we're talking about a mobile and other diseases, then we have to talk in ASD. We have to talk of 5 mobiles. They're fit together. It's really complex. We have a lot of research in this in this disease here in the last couple of years. It's incredible what happens here with the autism, because the autism is increasing each year.
Yeah.
For
multiple reasons.
For me, the ASD is something like there's something going wrong with our society, because it's increasing, and depends on multifactorial things like environment, like drugs, like other things, like food intake, like your body. And for me, ASD, you more people suffering in ASD, more problem you have in your society.
Yeah. And so what,
like a lighthouse, like a beacon.
What you're saying is much like the canary in the coal mine, analogy that I've used multiple times for identifying risks in a coal mine, the rates of autism that we're seeing culturally worldwide is an indicator of how poisoned our environment is, because the weakest of our population is showing signs and symptoms of being even more screwed up year over year over year. And you're hitting on the fact that there isn't, I think this is a big thing when it comes to medicine or wellness, and it goes back to your mobile analogy, which is honestly the best analogy I've ever heard on really identifying the issues. But this is not a single source issue. It's multifaceted. So when you look at that mobile,
it's more than multifaceted, because it's impossible for researchers to look at the one thing who can salute this disease. It's impossible. It's more and more and more, because there's tremendous research in this area. In the moment, in the last couple of years, only in the last 2 years, only in this year, and this year is about 1 month old.
Yeah.
You find tremendously research papers about autism in the last 3-4 weeks. Yeah. And we're looking, when you have a look, last year, 2020, I told you there's 80% only about the microbiome ASD. And when you're looking at the research in PubMed, you find a tremendously number of scientific paper in this issue. And it's impossible to find the one solution.
Yeah,
This is not possible. It could be, because this call Dory wants to make today is a very sophisticated call, because we have to look at everything. Yeah.
Which is why we have time to do it. I've already texted one of my friends and said, look, I'm in the middle of doing the greatest autism webinar in history, which is
we don't look at the infections. We don't look at the trucks. We don't look at the mitochondrial dysfunction. Yeah. We don't look at the vaccination. Oh, is there something?
I think we just got banned on YouTube, but you can say that because you're a virologist. If I say it, I'll get lynched. But I think it's the important part of being.
You know that there is an interaction between vaccination and ASD. Yeah.
Yeah. Well, and just the part that you're hitting on with the DMT aspect, and I've chatted with a couple of my colleagues and friends and some of our ambassadors and customers and colleagues, because there's so many people that are talking about using psychedelics and microdosing. I'm like, you actually don't need to do that if you just use clean slate and a bunch more zero in than you might think you want, because you can get there in a hurry. But that's a whole other conversation.
I told Dory, with each slide in this call, you can make a call.
Yeah.
Yeah.
For sure.
Absolutely.
And this for the next hours. You can make a call with ASD and fluoride. Oh, fluoride. Next slide, please. Fluoride, very interesting, very interesting.
Oh, we're going to dopamine now.
Oh, dopamine, okay, dopamine. First of all, the neurotransmitter, it's more interesting. The neurotransmitter, it's incredible what happens here. It's your
Oh, I thought you wanted to say something.
No, you.
No, I just have a very very little thing, but then you guys can chime in here. Well, dopamine, as we know, is the feel-good neurotransmitter. It's a chemical that carries information between neurons into synapses, and it's that tiny gap between them is vital for proper function of the central nervous system. It regulates feelings of pleasure and motivation. However, deficits in dopamine circuits have been implicated in a wide range of psychiatric disorders, including Parkinson's disease, schizophrenia, drug addiction, ADHD, And roughly 30% of children with autism also have ADHD, and dopamine has also been linked to autism. Did you want to comment on that? Add more to it?
No, it's okay.
Stefan? Okay. Because we're only halfway through. So
The dopamine.
so I mean, I'm sure we could have spent an hour just talking about that, but we have a lot of points to get through. So it's not, we're not going to give you a biology lesson. We just want to like hit on some main points and show the connections, you know, and where we're leading to. So so I like to say this: your DNA may load the gun, but your epigenetics is what pulls the trigger. So let's look at this for a minute. So autism spectrum disorder is thought to be caused by predisposing high-risk genes that are, you know, are altered during early development by environmental factors. So that's why I wanted to show this slide here, because if we see, look at here, the epigenetic mechanism, this environmental chemicals, you know, drugs, diet, development here, and it's right here, environmental factors. And these are linked to infection, air pollution, pesticides, folic acid, and also a risk, increasing risk of ASD. So autism genes are selectively targeted by environmental pollutants, including pesticides, heavy metals, and your forever chemicals, and other foods, cosmetics, and household products. So with older parents and grandparents, transgenerational, well, older parents and grandparents increase the risk in children by 50%. It's very high. A new analysis suggests that children born to parents 40 and older are 50% more likely to be diagnosed with autism spectrum disorder than those mothers and fathers who are between 25 and 29. This also applies to grandparents, making this transgenerational. And Clayton, you mentioned this about premature infants. Well, parents who were premature themselves are more likely to have a child with autism. So a Yale School of Public Health study found that parents who themselves were premature are nearly twice as likely to have children with autism spectrum disorder, and that can actually span multiple generations.
Here's an interesting question that's a whole other hour conversation at its own point. Much like blood types are attracted to one another, do you think people that were born prematurely, because of their resonance and their epigenetics, that they're actually attracted to one another without knowing it as well? Interesting correlation. Food for thought.
Haven't thought about that. Do you know somebody like that?
Nope. I'm just looking into an interesting sociological analysis that would be intriguing to see if there's been any data published on it.
Okay. Well, this next slide is pretty interesting, which really surprised me. Well, there was a study that came out showing the evidence of, in the US, showing the evidence of autism, this epidemic they're talking about acetaminophen, and as we know it here in Europe, paracetamol is actually aggravated with the antibiotics, amoxicillin, and also it's and now with glyphosate, which is going to lead us to the glyphosate issue, which is interesting because I remember when I was pregnant that the doctors would always say, oh, you have a headache, or oh, you have this, or you have that. Even when you're pregnant, okay, it's safe to take Tylenol. It's safe to take acetaminophen, no problem. So, and these are all the studies related to acetaminophen and paracetamol, which is like, wow. And of course, this is, again, like this is tied to glyphosate as well, which that's this study here, good 2018 here. So, which leads us to glyphosate, because glyphosate, as we know, is Roundup. It is a broad spectrum mineral chelator, robbing plants and animals of important minerals and destroying our enzymatic process and our gut microbiome. And just like heavy metals, it's in the air, it's in the water. I mean, it's everywhere. It's in the soil, it's especially in the food that we eat. And for ladies with they're still having tampons and pads and stuff like that, it's in those products as well. It's a wide use of glyphosate has become a concern due to the potential harmful effects of human health and infertility for both men and women. And by the way, we have a very good discussion on this topic on the YouTube channel, The Root Brand. So I suggest that you go there for that discussion, because that's a really good discussion, that one.
Can I add one note to that real quick?
Sure.
Because I don't know how far we get to go on this yet, because this isn't all my surprise, which I love. The important part to understand with glyphosate, because most people understand that Roundup is a weed killer, right? But it's so crucial to understand the actual biological mechanisms that glyphosate works in the environment when it's sprayed on plants. It doesn't kill weeds. And I learned this from Dr. Don Huber, who is the biggest opponent of the use of glyphosate, probably the leading researcher in the world on the subject since 1974. Glyphosate gives plants AIDS. It is an immunodeficiency that it creates in those plants, in those weeds. The pathogens in the soil kill the weeds. So you have to look at that application on what's happening to our microbiome and translate, and then I turn it over to the virologist. It all belongs to Dr. Rao.
It also is suggested that glyphosate could increase the dysbiosis in your gut. Yeah.
Through the same mechanism. It destroys
responsible for the disbalance of your microbiome.
Yeah, it just creates chaos and kills off all the good stuff and allows the proliferation of bad stuff if you're not doing anything to rebalance it.
And this is a global problem. This is just not something that's happening in the US. It's all over the world. The glyphosate is everywhere. Okay. I was actually going to put a slide in here for you, Stefan, for the Shikimata pathway, but I thought that's just way too much. But you guys, if you want to go and learn about that, you can go to our call on glyphosate, because we talk about the Shikimata pathway there.
Okay.
Okay. Now, this is super interesting. Okay. So glyphosate inhibits the cytochrome P450 enzymes, which is an important enzyme for metabolism and the acids in the gut bacteria. So glyphosate increases the chemical residues and of course the environmental toxins, but it's well established that autism is associated with gut dysbiosis and excess anaerobic bacteria in the feces of autistic children. So I thought this was interesting here because glyphosate is inhibiting the P450 enzyme. Before I move on to the next slide, did you want to say something about this, Stefan?
The main point is here that this system in your liver is responsible for metabolizing drugs and other things. Yeah. And here you also find again the gut dysbiosis. Yeah.
Yeah. Okay.
And the interaction between this system and the gut too.
Okay. So the reason I brought this up was because we talked about this last week. This is vitamin D. And look at this. Glyphosate suppresses the cytochrome P450 enzyme. And we need this enzyme down here because this is CYP2R1 here. This is the first hydroxylation that occurs in the liver, right? It can't even do it right because of the suppression with the glyphosate and the vitamin D. Right? I mean, like, see the connection there? It's really interesting. And then you need this connection. You need this first hydroxylation so that you can actually make the active form in the kidneys The
Yeah.
second hydroxylation needs to happen here. But it can't do that, right? Because why? Because you've got this glyphosate suppression going on with this cytochrome P450 enzymes. Isn't that interesting? Okay, I think it's interesting.
It is. I'm reading chats as we go, because there's some good comments.
Okay.
You start to correlate all of the
You see,
pathways.
you see how it's like all coming together, right? You've got like glyphosate, you know, and then how important vitamin D is, so critical. And you know, one of the reasons why I wanted to do this call was because I think I told you, Clayton, last week I was talking to someone who said, you know, these products are for old, you know, like old people, like for people that are, you know, baby boomers and things like that. And I say, no, no, no. I mean, this is for everyone. And I think you'll start to see that
This is for everyone.
this is like really important.
If there's individuals, no matter their age, that want to function optimally, and when I say optimal, that's beyond what is normal, you know, because normal right now is closer to autism than it is to being elite. And if you want to function, you know, it's like we talk about in, you know, other aspects of the world now, that we're becoming more spiritually advanced, and that, you know, there's this great awakening. Well, here's a secret. If you want to wake up, the first thing you have to do is decalcify your pineal gland and get all your processes working properly. I think we're hitting on those. So that's it. And you saw the benefits of dopamine and serotonin. We'll probably see more of that. I mean, they're the two most powerful neurotransmitters made.
Well, what I'm saying is
easy.
that if you want to start a family, you need to clean yourself up first, right? You and your spouse need to detoxify, clean everything up, and, you know, make sure that you have, you know, enough vitamin D in your system and things like that.
And the likelihood is that you're going to have difficulty having children because of glyphosate, because of the metals, and because of the other stuff.
Well, that's true too, because of the fertility issues that the glyphosates cause.
And Dr. Huber, I mean, when he called glyphosate an extinction event, it's shocking, but it's a fact. I mean, we're seeing fertility rates in this country drop by 30% over the last decade. We're in a really, really unique point in time. And if you're wanting to pass your seeds on to the next generation, and you're not doing everything you can to create the most pure, viable seeds possible, just an opinion.
Okay, next. Okay, so here we go again with here's the glyphosate and autism rates. I mean, are in our glyphosate call, but I thought I'd just bring it up now just to show you. And here are studies. And here, interesting, is glyphosate and ADHD as well.
That's a correlation.
Well, look at this. I put them side by side, so you can actually see. Look at how it's going up, right? So I thought that was interesting.
You find in both diseases, you find an increase of one bacteria. It's the Clostridium. When you get glyphosate in your gut, there's a disbalance of bacteria, and there's one. This is the Clostridium.
Mm-hmm.
Yeah.
Okay. Okay. So in here are ADHD and heavy metal connection here studies. Oh, now we're going to glyphosate and fertility. And here's studies on that.
Oh, I think we just hit on this.
And yes, and look at this here: infertility treatments, IVF treatments during, for pregnancy, and the risk of autism. So
keep going, because I'm going to hit on this, because this leads to one of our first conversations when we started doing this over a year ago. But go.
Okay, well, actually, progesterone exposure during the critical period of fetal life is an elevated risk for autism spectrum disorder, and is actually reflecting the epigenetic modification. In addition, pregnancy achieved via IVF is associated with a greater risk for gestational diabetes. So, a meta-analysis actually found that women giving birth to single babies who become pregnant via IVF techniques or other similar methods had a 53% increased relative risk of developing diabetes, gestational diabetes.
So let's look at the correlating factors of this real quick. So if a woman is so toxic and polluted, she's incapable of getting pregnant on her own, and she chooses to use IVF where they plant an egg in her, and then her body starts doing something that, because it was so toxic, it wasn't natural in the first place, but when it's forced, it creates a chain reaction of chaos that leads to additional symptomology. And because of the amount of metals and toxins that are in her system that are inhibiting her from getting pregnant in the first place, when that egg is implanted, it's going to be further poisoned, because we know the data on 30% of the mercury and other metals being passed from the woman into the womb, during the gestational period. That, I mean, you're willingly throwing a new life into an absolute cesspool, and then thinking that everything's going to be good because you were able to get pregnant artificially. It's a really difficult process, and it's one that you have to look at and say, great, you know what? Maybe this is a sign that I need to do some additional things before I get pregnant, instead of going the artificial route.
Well, gestational diabetes, women who develop gestational diabetes in the first 26 weeks or the first 5 months of pregnancy are 42% more likely to have an autistic child. And experts believe that the spike in the mother's blood sugar levels may disrupt fetal brain development. In addition to that, there is also a link between gestational diabetes and vitamin D deficiency, as much as 40% among pregnant women. So maternal vitamin D deficiency increases the risk of preeclampsia, bacterial vaginosis, gestational diabetes, spontaneous abortions, preterm labor, and can also harm the unborn fetus. So this is just a slide just to show you the complexity of that.
Well, it just goes back to the key point that we're trying to simplify some concepts that, as Dr. Rao was touching on, science is trying to catch up to right now. This is the primary area of study, but I think this is the fun part for everybody that's here, if you're watching this, with our philosophies in the root community. And as I've mentioned numerous times before, the amount of intellectual capital that we have, and this is the fun part, because we've got phenomenal PhDs, not just doctors, but research scientists and very well respected, biotech, virology, stem cells, super geniuses that are all coming together, to provide benefits for the greater good. But it's only through the collaboration of all these beautiful minds that we get stuff like this. And this is why we're here.
Thank you. So here is gestational diabetes studies with vitamin D connection. I thought this was really interesting because there's like pages and pages of this. Here's one. I mean, there was like over 100 studies connecting, about gestational diabetes and the vitamin D connection. It's major. So now we go to high blood pressure tied to developmental problems in children. This was interesting because a total of 983,805 single live births at term were recorded in Norway from 1991 to 2009, demonstrating that preeclampsia has been linked to CP, cerebral palsy, autism spectrum disorder, and attention deficit.
And Dory, I ask you one question when we look at that data. Your compendium says what about high blood pressure? Metal.
Oh, that's yeah, that's a major thing. So with that, you're talking about the study from the British Medical Journal, the 350,000, 350,000. We have so much data on that, you know, showing heavy metals and hypertension. It's huge. So this is something that I thought was interesting because it all goes hand in hand with the problem that, you know, when we start connecting everything together, which we'll see here. Preeclampsia and heavy metals. Here's a ton of studies showing the correlation between that, okay? And Dr. Rao's favorite.
Oh, my favorite.
Go ahead, take it away.
Me? Why me?
Because you're the one who brought this up.
When I'm working at school, I'm wondering because sometimes there came dental assistants in the school to teach the children how to use toothpaste with fluoride. I don't understand this stuff, this stupid stuff. And when you're looking, you have fluorification in water in a lot of areas in the world around, in cities. And how to solve this problem when you go to the supermarket to buy some salt, there's fluoride in there. I don't understand this stuff. This is a neurotoxin. This is not a trace element. You don't need fluoride for your body, never in your metabolism. Okay, what we can see here, prevalence. Please, Dory.
Next.
Next, this is Asia, the ASD prevalence in countries with endemic fluorosis. And the next is Europe, and there you can see the prevalence of 10,000, and it's increasing.
Yeah.
The last.
Well, if you go back one slide, there's a number that Bill Gates would be so happy with. I just noticed in Bangladesh in 2016, there was 1 in 666. He'd be so happy with that number. Okay, you can go forward.
Yeah.
You're so bad.
He also has ASD.
Yep.
Who?
Bill Gates.
Oh, okay.
And ADH too.
Okay. So.
Yeah. Mm-hmm.
This is the Suleiman study that you were talking about. Aluminum, cadmium, mercury, and autism spectrum disorder. These are the most common heavy metals.
Suleiman study, yeah, I remember.
Mm-hmm.
We
talked about it. It's a 2020 study here, clinical chemical research here. And here, this was interesting. I've seen these studies before about baby teeth in autism. Baby teeth linked with autism and heavy metals here. Researchers observed higher levels of lead in children with autism throughout development, with the greatest disparity observed during the period following birth. And they also observed lower uptake of manganese in children with autism, both before and after. And the pattern was more complex for zinc. So I think you mentioned earlier about zinc too. So children with autism had lower zinc levels earlier in the womb, but these levels then increased after birth compared to children without autism.
Mm-hmm.
Do you have any comments about that, Stefan?
No, it shows me that zinc is one of the most important trace elements in the homeostasis of the immune system and the gut and everything. Yeah, you need zinc.
Okay. And then these are just studies showing autism and heavy metals. There we go. More and more and more and more. And now we come to connecting the dots, because I always at the end always like to connect the dots, but there were so many dots here. We had to make this slide up.
69 slides now. 70.
I think there's like 70 slides, but to show you the complexity of this, and we haven't even touched on all of it, and we're just kind of scratching the surface. But the main point that I wanted to show you was that you have epigenetics, you have chemicals, you have environmental toxins, you have heavy metals, and all of these things here are playing a part in all these other things that are going on that are helping to create this.
And that really hits on what we're talking about.
We don't talk about calcium, the low bone mineral density.
Well, and lead displacing those, and it coming out in bone and teeth, especially with baby teeth, that you can see the lead toxicity there, because it decreases calcium absorption because it's replacing calcium. But then we can go from autism to ladies in their 50s when they become menopausal, and they say they have osteoporosis, and it's actually just the lead leaching back out of the bone. So we can go full swing and go from one end to the other.
Well, didn't we not talk about that last week a little bit?
We did.
Mm-hmm. Okay. Mm-hmm. So Clayton, this is where you take over.
Well,
the floor is yours.
I'm gonna do my terrible product placement message. So you have your clean slate, you have your zero in, and I think we could do a whole other hour conversation on just the ingredients of zero in and how it pertains to this entire conversation because of the vitamin D, and I think it's an undersold and under-discussed ingredient in zero in, because it's there as a catalyst in the reaction. But as we've seen, the importance of vitamin D in the production of dopamine and serotonin, and as Dr. Rao has talked about previously, with the PACs and the pine bark extract and regeneration of the microbiome and how supportive that is, that we talk about what zero in does, right? Focus, mental clarity, but now also, the adaptogenic nature of looking at rest and how your gut will shift to producing more serotonin to work, with your pineal gland. And so you can produce more melatonin at night. But I think it's so crucial that if you're here, that you understand a couple components, like I was hitting on, the intellectual capital that we have. And I was talking with our collaborator, that is our manufacturer with Zero In, who collaborated with Christina and a little bit with myself, because I got to be in the middle of the party when we were doing this. But this specific formulation of Zero In is done, and people looked at it initially and they said, well, there's only 7 ingredients. How is this going to be beneficial? But what's so important to understand is that those 7 ingredients are sourced with the highest quality components, and they're designed to work so synergistically, just like that mobile that Dr. Rao hits on, that it's working on multiple facets to produce a desired outcome. And then when you take that effect that you have in this amazing capsule, and then you bring in, especially with the new solution, and people are freaking out going, hey, it tastes different because we added the trace minerals. But what Clean Slate is and what Clean Slate does, and my bottles seem to have been leaking, so I need to take some right now. Don't do what I do. Everyone else use this. Don't do what I do. But the importance of being able to passively, and especially when working with kids, right? If you have a child that's in the spectrum, and that you can give them, and honestly, a lot of our community is doing this. You do one single drop and allow that process to start taking place, because it's a scientific absolute that that little drop is a bunch of little magnets for toxins. It'll grab onto them and help them be flushed out. But it's something that is safe, it's passive, it's completely systemic. And we're hitting on especially this subject from both perspectives that are so crucial. You have to get the bad stuff out. You got to remove the mercury. You got to remove the glyphosate, the lead, aluminum, cesium, strontium, cadmium, arsenic, lead. You can go down the list. You've got to get all this stuff out. But at the same time, your second brain, the other key component, as we've been hitting on, your gut, your microbiome. And I'll give Dr. Rao a bunch of cred as well, because of what he's taught me on the microbiome, or your biome as well as the microbiome. You have to be supportive to both, right? So we're going to clean up the mess, but then you're also going to feed this strategic formula to your gut, which we've hit on is extremely important. It's where 90 to 95% of those neurotransmitters are produced. It allows both of them to start working together simultaneously, properly, but differently, to get, my favorite word, outcomes that, and I've been doing this for 16 years, I've never seen this stuff before. I've never seen the results and the outcomes that we're seeing now. And it makes me giddy. But if you're here, because we've got a good amount of people that are here with us, or if you're watching this on the recording, this is just fact. If you want your kids to be healthier than you are, you want them to have the best chance at performing well in life, if you want to be here to enjoy it, and if you always feel that you're just not quite where you want to be, and being an athlete, that was the key for me growing up, is, okay, what can I tweak to get better, right? And the Super Bowl is in 2 weeks, and one of the participants in the Super Bowl is probably one of the best examples of this, because Tom Brady, we're the same age. He's still playing football because he's constantly tweaking, trying to improve. And this is the key that's available for all of us, is and I'm trying to get in touch with his people. I know a couple of my colleagues know his people. If you want to continue to get better throughout life, eliminating the metals and toxins and chemicals that are destroying us is step number one. And then allowing your brain to function at its highest levels possible are the two most important things we can do. And I mean, there's what we just got was a PhD level dissertation on the spectrum. And Dory, you and Stefan, I'm working with, I haven't told anybody this yet, but I'll drop a little hint at it. One of the top functional medicine doctors in the entire industry starts a study on clean slate and zero in for 12 people next week for 2 months. And I mean, he's one of the guys that the rest of the industry comes to for information. And, A4M and all of these doctors that are interested, or the Institute for Functional Medicine, I've never seen a presentation like this that you guys put together. I mean, because there's not been a compilation of information to be able to tie all of these factors together, because no one else has ever done this. And that's what's so important for everybody to understand, is it doesn't matter who you're talking to. They've never done anything like this before. I mean, everybody here, you've never taken products like this before. If you had, you wouldn't be here because you'd already be amazing. So we're all learning, but we're doing things that have not been done before. And you can see by the pedigree of, the people that I get to hang out with Dory and Stefan, they're not here because of hype. They're here because of substance, and they create more of it, which makes all of our lives better. But that's, hopefully this has been informative for you, and it gives you an opportunity to share this, because I'm going to tell you right now, once I get this posted on YouTube, as soon as Dory sends it over, I'm sending this out to a ton of people, because this is something, the autism conversation, I don't think that there is a group of more informed or motivated women on the planet than moms with autistic kids, because they're constantly doing research. They're constantly trying to find solutions. I know families that have spent their entire life savings, millions of dollars, on trying to find a solution for their kids. And you know where they got? Broke. Still have an autistic kid, but they have no money left, because there hasn't been the proper solutions. And I'm not saying what we're doing is the end all be all, but what I'm saying is we're doing some stuff that's never been done before. And if you get to the point where you're seeing outcomes and no one competes with you, you might want to look further into it. So Dory, Stefan, thank you. And that's my rant. I'm out. As Kobe said, since this is the anniversary of Kobe's death last year, Mamba out.
Did you want to look at any questions?
Let's go through the chat. Look, there's more. There are some great comments though on here, today, especially for our German contingency, and they were talking about glyphosate being banned in Germany. Because people think, as we talked about, people think that the glyphosate's been banned in Europe. Like, no, sorry, not true.
Well, that's why I said it's a worldwide issue.
It's a global issue.
It's a global issue. I mean, people in Europe think that it's not it's not an issue for us, but it is, and that's what we talked about last on our glyphosate call, that it very much is an issue here.
And you can't just look at the current on all of this, right? Because you hit on the generational aspect and the transgenerational aspect of environmental toxicology. Glyphosate's been in our world since 1974, almost 47 years. So you can't just look at now and going, oh, they removed it. No, sorry. It's been used for 47 freaking years. But if you're in Europe, Monsanto used to be a United States corporation. Bayer's a whole hell of a lot bigger than they were. To give you an idea, Bayer knew the risk. Bayer knew that if they acquired Monsanto, they were going to end up paying billions upon billions of dollars in settlements because of what that chemical does and what has been proven to do to cause cancer and lymphoma and leukemia. They still bought it. What does that tell you? And you think that a company that's making billions of dollars a year is not going to invoke their influence to say in 2023, no, I think we need to keep this party going. This is the hard part. You can't rely on outside influences to provide any benefit to you anymore. We know how that goes. So if you're not taking responsibility for your own health, you're not going to be here very long. I mean, you can't get away from this stuff. Acetaminophen is Tylenol, right? Isn't that?
Yep. It's Tylenol.
It's either Tylenol or what's the other one? I don't use either one of them.
Well, here in Europe is paracetamol.
So, Dr. Rao, there's a question for you for an autistic 7-year-old boy.
I saw these questions about the autistic 7 years old from Romeo. You know that we can't give any recommendation about taking vitamin D, K, and zinc, and this one. Yeah, I only can give recommendations.
What would you know? What if you were 7 years old? What would you do?
When I'm 7 years old, I have mother said, "You have to take this."
And what would you think, knowing what you know now, if you went back to be 7 years old?
Oil. When I was a young boy, I got this fish oil. You can
Oh, yes, everybody gets the fish oil here. And we actually,
Germany,
didn't
we
we?
call it Lebertran, you know that.
Yeah.
And we don't talk about the omega-3
Oh,
and
yes, I remember that now. Yeah. Yeah.
But this is one of the main points. I would take, when I'm 7 years old, I would take fish oil.
Uh-huh.
This
Good
is
fish oil.
natural
But it's hard to
product.
find.
And there you have, I have no recommendations in this directions, vitamin D, K, and so on, zinc. You know, zinc 50 milligram to 30 milligram daily, not more in this range. And you use it when you're older you are, you have to use zinc because zinc depends on aging. Your aging increasing when you don't take zinc. You need zinc when you're older. Zinc decreases when you get old.
And the benefits of zinc are quite vast.
Benefits of zinc are incredible. Not only for the immune system, and there are some study who showed that for all the men here older than 15 years old, you have to use zinc because there's a relationship between prostate cancer and zinc. And zinc is very important for homeostasis in the gut, for homeostasis of your tight junctions, of your barriers. This is important. Yeah, Romeo, take fish oil. It's still available.
Yep, and you just have to find a really, really good source.
Uh-huh.
And
without plastic.
Yeah, that's really the hard part is
this is the
not only the plastics, but now the radioactive isotopes. So you can't go to the Pacific Ocean anymore. You're really tied to some specific areas, and our fisheries aren't as good as they used to be because the rest of the environment's polluted. And as Dory's been able to hit on, we perceive Norway to be so clean and pristine, but because of the amount of mercury and aluminum and such that's in the jet stream because of multiple aspects, that all gets dumped in the water. And so it's playing that game, which goes back to the importance of the conversation of you have to try to eat well, right? You want to eat well, you want to put good stuff in, but through that process, you're naturally going to be exposed to more bad stuff. So you continually have to work to get that stuff out.
You are what you eat. Yeah.
And you are not only what you eat, you're all the poisons that come along with it.
Yeah, but we have a problem with the fluorification of water. Yeah, this is what you can do.
Yeah, well, and that's where our little friend comes in. That's one of the reasons. It's funny that municipal water systems use clinoptilolite as a primary filter. In the large filtration tanks. After they do that, they add the fluoride back in. It's like, come on, you can't win. It's like the party's gone bad.
There's another question for you, Stefan, from Romeo.
Question about the autistic boy, 7 years old. Yeah.
No, for a 16-year-old, how much C, D, K, and zinc?
Vitamin C, I take 1 gram.
1 gram.
Yeah.
Daily?
Daily.
How often? How far do you spread that out? You don't do that all at once, or do you?
I take different things daily. I take vitamin D every second day, 10,000. Yeah. I take zinc every day, 15 milligram. I take DHDA. I take vitamin C, 500 milligrams to 1 gram, and I take fish oil.
So when you're taking
the last time I take some polyphenols from grenadine, pomegranate, because they're really antiviral.
So the question I had for you on that from a supplementation perspective, because do you spread out what you're taking, or do you take everything in the morning, or you take some stuff in the morning and then some stuff in the evening?
Oh,
You space things
morning,
out?
evening when I wake up with a smoothie, mango.
There we go. Let me see. What else do we got here? I think that's about it. We did good.
We
Did
covered everything.
So
Okay.
no, I want to say thank you for both of you for putting this on. As Dory, the slides, the amount of time and research that you have to put into doing this, especially this. I mean, what was there? 387 slides.
Wow.
It's amazing. So thank you both for taking the time and hanging out, and I think everyone else is grateful here. So I think everyone says thank you, but no more questions. So.
All right. Well, I think we'll end the call for tonight, and then thank you, everyone. I hope it was informative, and thank you, Dr. Rao, for joining us on our call today, and Clayton, and everyone else for taking the time out to hear our discussion today. So we'll see you next week, same time, same place.
Okay. See
All
you.
right. Thank you.
It's a birthday party next week.
Yeah.
That's right. It's Testimonial Tuesday and a 1-year anniversary for Root.
Bye, guys.
Okay. Bye-bye.
Bye.
Bye-bye. Thank you. Thank you, Roland. Goodbye, everyone.